Hi, I'm Rachel Wall, founder and president of Inspired Hygiene. And I have to tell you, I'm so excited to be part of the Dental Divas launch. I was honored to be asked. And you'll be seeing a lot more of me with articles and videos and lots of different content to help you really elevate your hygiene services, systems, and profits. Because at Inspired Hygiene, we love partnering with dentists, hygienists, and office managers to do just that. So that's why we're here, and we're happy to be here. So I wanted to give you a couple tips today, really quick, on what you can do to increase hygiene profitability in your practice. And you know, we get a lot of questions about, well, what is a productive or profitable hygiene department? And there are various benchmarks out there for hourly production, and you know, it always varies on where you are and you know, what type of practice you have, but there's one benchmark that you can really count on, and that's the 3-to-1 rule with regards to hygiene profitability. So you want hygiene to be producing at least 3 times their salary, including benefits. Okay, so that's one benchmark. And the way we look at this is, you know, a third of the production goes towards hygiene salary plus benefits. A third goes to the overhead of the hygiene department. So this is, you know, your equipment costs, the rent for that space, any utilities and supplies and things that they may use. Also the staff that, you know, keeps hygiene rolling, like your administrators and people who make confirmation calls and schedule appointments. The other third should really be profit for the practice that you will be feeding back into hygiene through continuing education, you know, incentive plans, new equipment, things like that, things that you can really help to drive the practice forward. So this is really your first profitability point. Once you get to this, you know you're making profit on hygiene. If you're below this, then your task is to look at what things are falling out, what's falling through the cracks that we really need to focus on. If you're over this, then good for you. And there are some practices, depending on their situation, where they need to be higher than this because they need to create more profit from hygiene at this particular time. But this is your benchmark. So there are really 3 things that you can do really quickly to increase hygiene profitability and production. So one is obviously reducing open time. Okay, so reducing the amount of open time. This is something that quite a few practices are struggling with right now, but what I find when I see this is there are a couple things in play. One is their confirmation process really isn't solid. They may have a system, but it may not be in action. The other thing is that they may not be fully tapping into the amount of periodontal disease care that's in the practice. So those are the 2 things that you can really tap into to reduce open time. And if you have open time, it's actually a really good time to focus on this because you're not so busy that you can't get things done and get patients in for higher level care. So the first thing to do to increase hygiene profitability obviously is to decrease the open time. The second part of that, just like we talked about, is to really evaluate and elevate your level of perio care. Okay? So elevate your perio care, your perio protocol. If you have one in place, look at how you can tighten that up. Are there areas of gray? You know, are you as the dentist maybe not being as clear with your team on when there's disease and when there's not? And even when you see isolated sites, that's a perfect time to get patients started into care before those sites seed other areas and that disease spreads. Okay? We have a great resource for you for continuing education and training on periotherapy, and there's no travel required. You can just go to perioworkshop.com and you can learn all about that. The third thing, and again, perfect segue into this, is to really increase your hygiene service mix. So if the only services that are taking place in hygiene are prophies and maybe x-rays, and that's true for a lot of practices, it's going to be really hard to get to this level, okay? So you've got to bring in other higher level services, things like periotherapy, perio maintenance, advanced diagnostic testing, fluoride therapy, you know, MI-PACE, pH testing and pH balancing products, home care products, cosmetic care. There are so many different things that you can bring into hygiene to really elevate the level of service that patients are receiving and also the productivity. Okay? So it is creating a healthy hygiene service mix. So all of these things are going to help to work together to increase your hygiene productivity. And there are certain action steps that you can do for each of these. Decreasing open time. Look at your confirmation process. You should be calling patients about a week before their appointments, because here's what happens. If your protocol is we call them 2 days ahead, then a lot of times you have to leave a message. And then you leave a message and then you're calling the day ahead, and then all of a sudden you get in touch with them and they've got a conflict and you don't have time to recover. The beauty of the week out call is even if something falls out, you have time to recover from that. You have time to get another patient into that spot, okay? We go into a lot of depth on this in our mastermind group, the Hygiene Profits Mastermind. First thing you can do with elevating perio is making sure your hygiene department is doing a complete pericharting at least once a year on every single patient. And here's the thing, this is a trend that I'm seeing lately, is we're recording perio readings, the pocket depths, but not recording bleeding. Make sure your team is recording all the bleeding sites. This is your indicator for active disease, and without it, we cannot make a diagnosis. First action step for creating a healthy service mix is look at the services that are coming out of hygiene now. Where are they weighing heavy? Or is it prophy heavy? Or are there periotherapy in there, but maybe not enough? You know, take a look at that. One thing you can do is look at the number of prophies versus perio maintenance. What you like to see is a 3 to 1 again. 3 prophies to every perio maintenance. Some practices are going to be 300 prophies to 1 perio maintenance, and that's a really clear sign that it's time you do something about that. You can go onto our website. I'm going to give you a ton of resources here. And get a perio calculator tool to really find out where you stand with regard to your perio service. You can go to inspiredhygiene.com/perio tool, and you can download this very simple, easy perio tool that within minutes with a production report you can determine your perio percentage and where to go and where you stand. So I want to thank you so much for watching the video, being part of Dental Divas. Don't forget to visit inspiredhygiene.com. We look forward to seeing you next time.